Okay. Is my PowerPoint up? Can y'all see it? Okay.
Yes, we can see it.
So, okay, good. So again, thanks for having me. And just a little bit about who we are and what we do is we operate crisis centers throughout Arizona. We're large crisis centers, one in Phoenix, one in Tucson, which is where I'm based. Or we see in each center either 1,000 or 2,000 adults a month, and one of our sees kids as well. We see a lot of acute people dropped off by law enforcement, um, very high involuntary and voluntary, and a lot of substance use. Most the heart of the operation is really our overnight 23-hour observation unit. We also have urgent walk-in clinics and some post-crisis transitional care clinics, as well as an opiate program. And so, as you know, for all of you who are working in crisis, there's a lot of challenges with crisis. And if you go and try to look up guidelines for how to do COVID in a medical setting, there's never anything around crisis. So, so like you, we've been just trying to out as we go along. Um, and so we've done improvise to take care of our patients, but also to take care of our workforce because we have 500 employees across our sites. Trying to keep the place staffed with 24/7, and really to keep the place open and being able to serve our patients, we have to make sure that our staff is healthy as well. And so we've, this is a schematic from OSHA, occupational safety, that talks you prevent infections in your operation. And everyone wants to talk about PPE and N95 masks, but there's many things you can do ahead of that, to have more of a systemic approach to not having the pandemic affect your patients as much as possible. And the first step is just to try to eliminate the hazard, they say, altogether, which so that's why we're asking people to stay home when they're sick and letting people work from home, screening everybody at the entrance. But now that survey, we want to get as much as our staff possible vaccinated. And so we really made a big push for this. And we started by just asking our staff, how many are interested in getting the vaccine? Back in November, before any of the vaccines had been approved, but they were kind of right on the verge of being approved. And we saw that about, just about over half said they were interested. For comparison, there had been a study that the CDC had done right around the same time, where 60%, only about 60% of U.S. healthcare workers are saying that they plan to get vaccinated, which was really surprisingly low, and kind of a big cause for concern. So we ended up doing a whole bunch of education for our staff. We did town hall where we went over a lot of the content that's going to be in this presentation. And then we asked our staff afterwards, did you find it helpful? And most people found it helpful, but there was still a lot of people that didn't go or review the online materials, but the people that went found it helpful. We did a follow-up survey, and this is in January now, beginning of January. And so the old November survey is there on the top for comparison, but that, in January now, we had 75% that said they either had already gotten vaccinated or planned to get vaccinated. So that made us feel better. That was a big improvement, and tracks what's going on nationally. Another survey had been done right around that same time, another organization, national survey, and about 25% of U.S. healthcare workers are now saying that they do not plan to get vaccinated. So that was about in line with national averages and from before. So that made. We also wanted to make sure our patients felt supported all of this. So we did this in a previous HR survey, and we had pretty good people either agreeing or mostly agreeing, but that did go up. Uh, with there's a whole bunch of stuff we've been doing around COVID that contributed to that. But when we looked at specific comments, though, because we always want to do better, the most, and this is a word cloud of the various things that people had concerns about, and so you can see there's a lot of stuff, long-term side effects, actions, and some stuff in here on breastfeeding and pregnancy and fertility, but they pretty much, most of them fit into this theme of people were concerned that the vaccine was rushed to market without enough data on side effects and efficacy. So we beefed up our vaccine education. And so that's the presentation that I'm going to show you today. But the point is that we really, to try to be effective, we've really made an effort to find out what are people's concerns and make sure that our education addresses that in kind of a clear and kind of like personalize it to what they're concerned about and not be so technical and just here's what you need to do. So first, and in crisis too, like, so but I'm speaking to a similar audience, but crisis is a healthcare function, but it's not unlike the hospitals and emergency rooms. A lot of our staff are social services staff, and so they're not nurses. They don't have that medical background. So we said, well, we just need to start with the basics. So how do vaccines work? And a vaccine is basically a tool that helps your body's immune system recognize a foreign invader. So usually we do that with you take the virus that you want to fight, and you either do something to it to kill it or make it a weakened version of itself that can't make you sick. And then you inject that, and then your body responds to it because it thinks it's getting infected. And then the process of doing that it makes antibodies and other things that your immune system does to fight viruses, so that the next time when the actual virus, you get exposed to that, your immune system already has antibodies and it's already primed to fight the real virus. And part of the virus that the immune system that is responding to, we call that antigen. The antigen, like I said, oftentimes is a dead or a weakened virus, or sometimes it's just parts. There's to make or purified parts of a virus what the immune system responds to, but the antigen is that thing trigger. And so for the COVID vaccine, you've all seen this pretty picture of COVID on the news everywhere. For the COVID vaccine, it's the spike protein, which is what all of the vaccines are using as the antigen. And that's the red things that I'm poking out. It's called a coronavirus because it has all those things around it. It looks like a corona. That's why they call it that, because of the beer. But so that's what all of the antigens are going to be, is this red spike protein here. And so the vaccines that are out, they are, and a lot of the concern is they are different. They're newer technology, but they're not brand new, like they just yesterday. We're all a bunch of gigs. They've actually been, scientists have been studying them for years. The Pfizer and Moderna vaccines are the first mRNA vaccines to come to market, but they've been studying these for years, and they've been doing human trials on mRNA vaccine, flu, Zika, virus, and even some cancers. They just haven't, they're kind of going at their normal science pace and haven't come to market yet, but people have been using these in humans for quite some time. And one of the concerns that we heard, from a lot of the staff was that they're afraid that it is going to do something to their DNA. There's this weird mRNA virus, and is that going to affect my DNA? And it doesn't. It has nothing to do with your DNA. But what it does is it, if you remember from your old high school cell biology, the way it works just in your normal cell is that you have your own DNA, and then your DNA which is like all the code for all the genes and proteins and things that your body has. Um, the DNA gets translated into mRNA, which is basically the recipe to make a protein like the spike protein. So vaccine does is, instead of having anything to do with your own genes, it injects pieces of the mRNA, which is the recipe for the spike protein, and then your regular cell machinery, like it's just going to make your own proteins. Instead, it makes the spike protein. So these are ribosomes, which, if you remember all this from high school biology, your ribosomes translate the mRNA into the proteins, and then it's the spike protein, which is going to teach your immune system how to make COVID antibodies. And then you can see the mRNA eventually it doesn't hang around very long. Your own body chews it up and it disappears. So, like, kind of an analogy is, it's like a Snapchat. It's there. It is your body uses it to make the proteins, and then it goes away. So then it's gone. So all that you're left with are the spike proteins. There are 2 of the mRNA vaccines out right now. The first was from Pfizer and BioNTech, which is a company out of Germany that they collaborated with, and then Moderna, and they both require 2 doses, and they both are about 95% effective after you've got the 2 doses. And the infographic kind of shows how many people were in the trials, and they did really make an effort to include people with making sure that they had good representation of both male and female gender, and also having a good racial mix as well. And the kicker with it, though, is the Pfizer vaccine has to be stored in this freezer that's like ridiculously cold. So it's like -80 centigrade, -90 something Fahrenheit, which most places don't have a freezer that can do that. So that's why it's being distributed mostly at hospitals or county health departments, because they have that equipment. And then the Moderna vaccine can be in a regular freezer. So that one is a little more easier to handle. So those are the 2 that first came out. And again, because these are newer vaccines, the first of these to come to market, a lot of people were like, well, I don't know what they put in it. It's new, it's whatever. So so there's actually not that much in it. There's the mRNA, which we talked about, which is the recipe for the spike protein, and it's basically encapsulated like in a like a bubble of fat, and then they put salt, sugar, and water in the solution as well, just to have it dissolved. And that's what's in it. And this is the actual list of ingredients. So there's the RNA, like we talked about, and then lipid nanoparticles. That's just like little fat molecules that make a bubble to put the RNA inside. And then salt, sodium chloride, potassium chloride. These are basically salts, and then sugar. So there's really not that much. There's not a bunch of, there's no egg proteins, there's no mercury or all these things that people sometimes get concerned around vaccines. But this is about as simple as it gets. The newest vaccine is the Johnson & Johnson vaccine that just got approved the other day. And that is also a vaccine it's a type of vaccine that's been studied for a long time. But this is not the first, but the second of this kind to come to market. Last year, Johnson & Johnson, same company, had a vaccine go through the regular FDA approval process for Ebola. And so it went through all the human trials and things like that, and was found to be safe and effective. For COVID, the way these vaccines work is they take what's called an adenovirus, which is one of the viruses that causes the common cold. And they take, a virus is the kind of delivery, which is like the capsule here, and with the genes that it needs to make you sick inside. And what they've done is they've taken all of the genetic material, the DNA, out of it. So it's empty. It's like an empty Amazon box. And then they put in, and so this empty virus can't make you sick. Um, it's just an empty shell. And then they put the DNA for the gene for the spike protein in it. So now it's empty cold virus, can't make you sick, but it has the instructions for just the spike protein. So this can't make you sick either, because all it is the spike protein and not the whole rest of the virus. And then they inject that, and then your cells, those viruses infect your cells, and then it has DNA in it, and the DNA gets turned into RNA, just like and from then on, it's just like those other two vaccines. Then your cells turn that DNA into turn that RNA into the spike protein, and then the spike protein is the antigen, which teaches your immune system how to recognize COVID spike protein. And then the empty virus, they get chewed up and they disappear. So maybe not quite like a Snapchat, but it's like an empty Amazon box. It's delivered its package, and then it gets chucked. So again, it's like not a very, in terms of what's in it, not a lot of complicated stuff. It's an empty virus and just the one gene that you need. And this virus, or this vaccine, the big advantage to it is that it's one shot. They actually are doing trials that are also studying having 2 injections like the other 2. But the way they did their trial, they were able to separately look to see like how well one shot did, and then they got approval right like immediately because it did work, while they continued doing the trial to look at the 2 shots. So because they wanted to get it on the market as quick as possible because we need it. And the other cool thing about it is it can be stored in a regular refrigerator for up to 3 months. So this one is going to be much easier for clinics and like outpatient clinics and stuff to have it and to be able to give it to people. Their study had about 44,000 people, and the locations were in the US, South Africa, and Latin America. And that's important because so its efficacy, it was 60% effective, which sounds bad, but I'll talk about that in a minute. And it was 72% in the US. And the reason those numbers maybe aren't quite as good or don't sound as good as the earlier vaccines is because these trials were happening, if you think back on the timeline, the Pfizer and Moderna trials were done before these new variants came out, and the Johnson & Johnson trial was still going on. And South Africa is where one of those new strains came from. So they kind of were tested in a little bit different conditions. And another cool thing about this shot is there's a small percentage of people that had an allergic reaction to one of the other 2. So this could be a good second shot for those people who had some kind of allergic reaction to the other vaccines. Oops. And so, okay, so these percentages, these efficacy numbers, what do they actually mean? Because they're a little bit misleading. The way the studies were done is if you had any symptom of COVID, then you got counted as having COVID. So if you kind of reverse engineer that, if you look at the 3 vaccines, so what percentage ended up with any symptom of COVID? And so for Pfizer, it was like 5%, Moderna was 5%, for Johnson & Johnson, it was 34%. So the efficacy is 100% minus those numbers. So that's where you get 95%, 95%, 66%. But the things that all of the vaccines did well was they prevented severe disease. So for all of these, if you look at, well, how many people got COVID and it was so bad they had to be hospitalized? And for all 3 vaccines, the answer is 0. And how many people got COVID and died from it? And for all 3, the answer is 0. So even though this efficacy number is seems really different, all of them are 100% effective at preventing people getting COVID that's severe enough to go to the hospital and preventing death. So the take-home message is there may be like a tendency to say, well, I'm going to hold out for the best vaccine. Um, the recommendation is to don't do that. All of them prevent severe disease. We need as much people to get as vaccinated as soon as possible for us to get what they call herd immunity, which where everybody has some kind of immunity, and then this horrible pandemic will hopefully be over. One difference, just to note, between the COVID vaccines and conventional vaccines. So like flu vaccines and measles and all those vaccines. A lot of vaccines, the way they make them is they inject the viruses that they need to make the vaccine from into chicken eggs. And so this is like a picture of some vaccine like factory where there's basically all these racks of chicken eggs. And then that grows up the virus or the antigen that you need. And then they have to purify it. And they have to purify it, and they have to use chemicals to purify it. And then they have to purify it in a way that's not going to mess up the protein that you want. And then they have to test that. So that takes a while and a lot of trial and error to get it right. One of the reasons why these new vaccines were able to be made so quickly is because the way that they're made is just way quicker. The mRNA is the vaccines, you basically synthesize that in a machine in the lab. And the adenoviruses, you make them in the lab with human cell cultures in the lab. So you don't have to do all this stuff with the chicken eggs and wait for them to grow and stuff. And they don't have egg protein. So for people who have egg allergies and have to be careful about vaccines, all three of them should not have that issue because there's no eggs anywhere. Now there are it's just stuff coming out on the news in the last couple of days. There are questions that come up is do they involve fetal cells and aborted fetuses and things like that. And some religious leaders have expressed some moral concerns about this, but to kind of clarify so what actually is in these vaccines that some people may find concerning. There are no cells or tissue from aborted fetuses used to make any of these vaccines. But the manufacturing and the testing process use what are called fetal cell lines. And these are cells that grow in like a petri dish in the lab that originally originated from a single fetus that was aborted decades ago. So they had the tissue in the lab, and then it divides and divides and divides. And so now it's many, many, many generations. It's like the great, 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 great grand kid cell of the original tissue. The Johnson & Johnson vaccine, the adenoviruses, they grow them in fetal cells that came from tissue from 1985. And the mRNA vaccines, there's no fetal cells used to make them, but some of the testing to see if it worked uses some fetal cell lines that came from an abortion in 1973. So the religious leaders that are expressing concerns, the vast majority of them are saying get vaccinated. Some of them, there's very few that are saying like don't get vaccinated. There's some of them though are saying that now that there's multiple vaccines out, if you have a choice, they find that the Pfizer and the Moderna vaccines are kind of morally better than the Johnson & Johnson vaccine because they only use some of these cells just to test it, not to make it. The recommendations that, again, most of these leaders are saying, if you have a choice, try to choose the Pfizer and the Moderna, but don't not get vaccinated because you don't have a choice in which one to get, because it's more important for everyone to get vaccinated. And there's a couple of quotes from some of these, from the Vatican, where it's saying it's, if there's no ethically irreproachable vaccine, it's okay to get a COVID vaccine. And that's what, both of the popes, it's so weird that there's two popes, but both of the popes got, I believe it was the Pfizer vaccine. And then this is from the U.S. Catholic bishops that just came out, I think yesterday. And they really make a point where not only is it okay to get vaccinated, but it's kind of like a love your neighbor thing. And it's, there's the morality of the possible fetal cells, but also the morality of getting vaccinated for the good of your community. Some more questions that people have. Can you get COVID from the vaccine? No. So none of these, so now that you understand how they're made or how they work, you can see that none of the vaccines have the virus in them. It just has a recipe for one little part of the virus. And they will not, the same thing is like, will they cause you to get a positive test? And the answer is no, because they don't have the virus in it. It's just one little piece. And then this is the big question that people always have concerns about is, did they skimp on safety? And they didn't. But then it's like, well, but they made it so fast and they rushed it through. And so I still don't trust that it's safe. So to understand that, first you need to understand how vaccines are made and approved. And so the top little timeline talks about that. So usually, and it usually does take years to make a vaccine. There's what are called the preclinical trials. That's like animal studies where they, are studying things in mice and rats and things like that. And then and then based on that, they say, okay, I've made a potential vaccine. And so the green stuff is the darker green is now all the human trials. So the phase 1 trial is they're just testing if we inject this in people, is it safe? They're not testing to see if it works. They just want to test, like, is it safe and what dose ranges are safe for people. Then after they do that, they pick what doses they think are going to be safe. And then they do another trial where they start to look at, does it work? And if they get good data that shows that it probably works, then they do these large trials. These are those trials with like the 40,000 people in them. And that's where they are, they've picked their dose, they've picked, how often you give it and all that kind of stuff. And now they're going to test that in a lot of people, and then give half of the people a placebo, and then half of the people the real vaccine, and test if it works. Then after all of that, they go apply to the FDA to get it licensed. And that's another thing people were concerned about was, oh, this FDA thing is like super fast. Well, I mean, in normal times, it's just like it's a government bureaucracy, basically. So they put in their giant application. It goes and it sits on someone's desk, and then like someone finally gets to it. Then they have to schedule it for a meeting, and then say they meet once a month. And, oh, you're not on the agenda this month, we'll put you on next month. And it just kind of chugs along with the speed of government. So that's the science part. And then, though, I have to remember, these are all companies doing this. And it doesn't make any sense to invest in building all the manufacturing and hiring all the staff it's going to take to make millions of vaccine doses way back at the beginning when you don't even know if it's yet. You wait for all of these things to happen, and then you're like, okay, now I'm going to invest in all this manufacturing. So what they did for COVID is, first of all, they kind of had all hands on deck. So people who are working on other projects, like people aren't concerned about Zika right now, concerned about COVID. So people just dropped everything to work on COVID. And then they did some of these steps that are done one at a time. They combined them. So instead of having these two trials here, the phase 1 and the phase 2, they did that together. So they used human subjects to then both to be injected with the vaccines to both test whether it was safe and also try to figure out if it worked. And so these people, yeah, they may have assumed kind of more risk than a study participant who volunteered, in the regular phase 1 trial did. So we should thank them for taking one for the team. And then from the results of this, they were able to do these the big placebo-controlled, randomized big trials. At the same time, and then when they went to the FDA, you saw just this last one came out, I think it was like on Friday or Thursday, they were like, okay, Johnson & Johnson released its report and sent it to the FDA. And then by Monday, they'd approved it. So the FDA kind of, dropped all their bureaucracy and was like, we're going to have an emergency meeting and then then give it the green light because it's an emergency. At the same time, they started ramping up. When they had a good idea that it was probably going to work, they started ramping up all of this manufacturing, even which is a risk. So Pfizer basically took it out of their own savings and like made a gamble to they said it was like $4 billion or something like that to just build all the manufacturing stuff, like gambling that it was going to work, which it did. Um, and then some of the other companies, Moderna took the Operation Warp Speed. That's what some of that money was to give to um, pharma companies to pay to do this with the understanding that it might not pay off. And so they were going to get government funding so that they could make that investment and not have to be, stuck with a big old debt if their vaccine didn't work. So you can see they didn't really skimp on the science. They just did things in a different order and kind of did things at the same time rather than waiting one at a time. There's actually, and you'll get this PowerPoint, but there was a really good 60 minutes on how, that came out right after the Pfizer vaccine came out, on how they did that. And one of our nurse practitioners recommended it because she was saying when she watched it, it really allayed a lot of her concerns. So they do a good job of explaining all of that. And then there's a bunch of other vaccines in the hopper. So there's these websites that are tracking it, so you can kind of see where they're at, and what's kind of coming down the pike next. And then the other big concern people have is the side effects. We don't know about the long-term side effects of the vaccine, and that's true. We don't know about the long-term side effects of the vaccine because they've only been out for months or days in the case of Johnson & Johnson. So, but we can review what we do know about the side effects of the COVID vaccine, because we do know about some short-term side effects, and then what we know about the effects of the COVID disease, and then just balance the risks and benefits, and people can balance that for themselves. But what we wanted to do was kind of lay it out in a kind of a systematic way so it's easier to weigh the risks and the benefits. So vaccine side effects. So we do know about short-term side effects, and these short-term side effects are basically like we talked about before, a vaccine the whole purpose of it is to stimulate your immune system so it can be ready the next time. And so most of the side effects that you get is actually that happening. It's what's supposed to happen. It's your immune system reacting to the antigen. So the side effects actually mean the vaccine's working. Most of them are, just, they're all kind of the same in terms of how people get side effects. They're injection site pain, fatigue, headache, muscle pain, low-grade fever. There's not really that much difference between the different vaccines and the side effects. For the ones, the Pfizer and the Moderna, where you have to get 2 shots, the second shot is worse, and I can attest to that. I got the Pfizer vaccine, and it was unpleasant, but it was a hell of a lot better than getting COVID. But it's it's not fun. Young and healthy. If you're young and healthy and you have a strong immune system, your side effects are going to be more annoying. Serious side effects have been very rare and non-permanent. There have been a handful of people have had a severe allergic reaction, which that can happen with anything, and you never can predict it. But some people just happen to be allergic to something. That's why when you go get the vaccine, they monitor you for 15 minutes. So I don't know if y'all have done any of the drive-through ones, but they do. You stay in your car for 15 minutes and they're walking around checking on you, and then they let you go after 15 minutes to make sure that you don't have a reaction. And then if you did, then there's medical people right there. And then the CDC, if you get the vaccine, they'll give you the little card. And there's an app where, and it's cool. It'll text you reminders and say, click this and tell us how you're doing today. And it's tracking the millions of people getting the vaccine and their side effects, not by name, but so it's not like tracking you like a microchip or something, but it's so that they can get more and more data on side effects and better understand it. So given that if you get the vaccine, you're probably going to have some of these side effects. The question comes up about taking like Tylenol or Advil, and it's okay to treat the side effects with that. It's recommended that you take these meds after you get the vaccine. Some people want to pre-medicate, but that may dampen your immune response, and that's the whole point of the vaccine, is you want your immune system to respond. So if you so don't take them ahead of time because you're going to kind of preemptively prepare. Wait until after, and if you get any of these side effects and they're unbearable, then then you can take an Advil or a Tylenol. Okay, COVID, the disease. What do we know about the short-term effects of that? And this is one thing that we would hear a lot too on people who are reluctant to get the vaccine. We don't know about all these side effects, and it's only 1%, less than 1% of people die from it. So I'll take my chances. And that is true. Less than 1% of people who get COVID die from COVID. But death isn't the only outcome to consider. I mean, that's kind of an all or none thing. Even if you don't die, having COVID is pretty crappy. Most people have a mild illness, which is fever, cough, shortness of breath, losing taste or smell, which still can be unpleasant. And some of our staff have been out, even though they didn't have to go to the hospital or anything. They were out for a while because they felt, pretty terrible. Other people end up with more severe illness and end up in the hospital. And so this is a study of US data that was done a little bit earlier in 2020. And the percentage of people that had COVID that needed to be in the hospital was 9%. So that sounds, it's pretty good risk. I'll take that risk, right? Until you start to look at, but that's overall, that includes everybody. If you start to then drill down by whether people have other underlying conditions, the risk, if you have any underlying condition on what the list they looked at, then 40% ended up in the hospital. So those odds, that's getting a little worse. And so this is from that study on the right. And these are, I just kind of highlighted some of the conditions. This is the percent that got hospitalized, and this is the percent that was so bad it ended up in the ICU. And so you can see diabetes, it's like half, chronic lung disease, cardiovascular disease, pregnancy. People were worried about getting the vaccine if they're pregnant, but a quarter of people who were pregnant who got COVID ended up in the hospital because their COVID was so bad. Neurological and intellectual disabilities, which is kind of our patients, that's 60%. Former smoker is nearly half. Current smoker was less, which I thought that was weird. But and then besides these underlying conditions, race and ethnicity also are tied to your risk of hospitalization. So people, Hispanic, Latinos, 3.8, Native Americans about the same, African Americans, also more than 3 times more likely to end up in the hospital. So when you look at this and you calculate your odds, maybe it's not just less than 1%. I don't have to worry. It's more complicated than that. And then the other thing we kind of hear, some people say, well, it's just like the flu, and so I'll take my chances. COVID's not the flu. If this is a study that was done in France, so these people are probably healthier than us Americans anyway, where they looked at the difference in what happens if you're hospitalized for the flu versus if you're hospitalized for COVID. And so COVID's in the dark blue, and then flu is in the teal. And so you see much more people with COVID end up with respiratory failure, venous thrombosis, pulmonary embolism, so it increases your blood clotting and the complications from that, kidney failure, needing to be ventilated, which is, it's never good to have to be ventilated, having to go to the ICU, and of course death in the hospital. If you go to the hospital, then you die. Way higher. It's like 3 times higher with COVID. If you end up in the ICU, more likely to be ventilated, more likely to die. And then even if these are for people who then survived their ICU stay, and this is how long they were in the ICU. So it's like 15 days for COVID, nearly twice what it was for flu. And it's no fun to be in the ICU. And it's a long haul when you get out too. Like I have a friend in his 30s, healthy guy. Was in the ICU in Dallas for 6 weeks, and had the deconditioning from being ventilated, and not moving that time, and his muscle loss, and all the physical therapy that he's had to do. I mean, it's just it's a long haul. So so these are the short-term effects. The other thing about COVID, and people say, well, it's just the flu. COVID, why is COVID worse than the flu? Because it does what the flu does and more. But wait, there's more. So and you don't have to know all the little details on this slide, but basically COVID infects the lining of the lung, which is what flu does. So it does that like flu. But the other thing that it does is it also infects the cells that line the inside of your blood vessels all over your body. And so what that does is it causes vasculitis, which basically means inflamed blood cells that leak stuff. You never want your blood vessels to be leaking stuff. And thrombosis, which means forming clots. And so if that's happening, then that affects every organ in your body, because every organ in your body is fed by these leaky, inflamed vessels that are making clots. So that's where you can get like inflammation of your heart, and that's why people get heart attacks. You get blood clots, which is why people get strokes, and pulmonary embolism, which is blood clot in your lung. And so you end up with your whole body has all of these different effects, downstream effects from the COVID. And so we're learning more now that, and if you understand that, then it makes sense that there's these long-term effects of COVID throughout multiple organ systems in your body, not just your lungs. And this is, we're finally starting to get data, because COVID's been around long enough to look at longer term effects of COVID. It's even got a name now, long COVID syndrome. And the data's been trickling out as we've got, COVID's been around longer, so now we can look further back in time. So the first studies that came out, these were some surveys of patients who had non-critical COVID, so not in the ICU level COVID. At 30 days, this is the percent that said they had any symptom. These are the symptoms that they were reporting at those time periods. So, still some of the taste, smell stuff, shortness of breath, a lot of fatigue, and it was worse if you're over 40. Then at 3 months, and then things that are bolded are things that aren't just self-report, but these are actually things that people can measure using tests and stuff. So at 3 months, 70% of people still had an abnormal chest CAT scan of their chest. And a quarter, when you do tests where they make you breathe in the machines and measure how well you're breathing and stuff, a quarter had abnormal lung tests. And again, these are people who weren't bad enough to have to be intubated with their COVIDs. 6 months later, and this was a survey that was about 3,800 patients from 56 countries around the world. But a lot of people, most people still having fatigue, post-exertional malaise, meaning that after they exerted themselves, they felt sick, like they had COVID again. And kind of relevant to us psych people, people feeling a cognitive dysfunction. People talk about like this post-viral fog and fatigue, COVID brain. And then this is the best study, and it just came out like a month ago, I think, where they followed the 1,700 patients for 6 months post-discharge. And so it wasn't just random people that decided to respond to a survey, and like only the people that were feeling crappy decided to respond. These were people that like they actually followed. And 63% had fatigue or weakness. A quarter had sleep difficulty and anxiety or depression. And then these are some things that they were able to measure. So, a lot with who still had kidney dysfunction. These are ranges because they looked at people whose original COVID was either mild, moderate, or severe. But about half still had an abnormal CAT scan of their chest, of their lungs. Either a quarter up to half had their lung function still, like on the lung function test, not functioning right. And then this is probably like the more real world relevant or translatable. There's a 6-minute walking test where they have you walk for 6 minutes at a brisk pace and see how far you get. And a quarter of the people failed that test, like they couldn't do as long as what would be expected for their age and otherwise health. So long term, it doesn't look very pleasant. There was a really good thing on PBS that talks about that. And part of that was they were looking at, how I was saying, it infects your blood cells. So this is like an electron microscope of like the inside of your blood cells, and you've got your cells that line them, and it's like your PVC pipe with a smooth, plastic inside. But then after COVID, these are what the blood cells look like. They're all chewed up, or the blood vessels look like they're all chewed up, and then of course things can get stuck and clogged and leak in there. It's not good. So then another big concern was there's information out where people are concerned about fertility or pregnancy, and so none of the trials specifically studied the effects on pregnancy or lactation or fertility, but based on the data that we do have, all the experts, medical experts, recommend that if you're pregnant or lactating, that you should get the vaccine if you work in a healthcare setting, or if you have those other risk factors for severe COVID disease, like age or other medical conditions. Because that, if you're balancing the risk of not knowing if there's any, if it does anything to pregnancy versus being high risk of getting COVID and then knowing that COVID is bad for you, the recommendation is to get the vaccine. And you can read the statements from all of these professional organizations. So this is the OB-GYNs, this is the doctors that take care of premature babies, CDC, Harvard has a really nice page on it, World Health Organization. Of course, always talk to your OB if you have questions about any of this. But when you look at pregnancy, pregnant women are at, like from what we looked at that slide before, just being pregnant makes you at high risk to have severe COVID, which could result in hospitalizations, intubations, all that. And in no safety concerns so far have been identified in any of the animal studies or in any of the women who became pregnant during the trial. Also, that preliminary data from that CDC app that's tracking people after they got the vaccine, they haven't seen any increased risk of like miscarriage or anything like that in the data that they've tracked of the people that've gotten vaccinated since they came out. As far as lactation goes, it's not really theoretically possible that the vaccine goes into the breast milk, because remember, it's like a Snapchat, it goes away. But the antibodies that you make may go into the breast milk, but that's how it's supposed to work. That's why one of the reasons why breastfeeding is beneficial is because you want to pass your immunity on to your baby. And then fertility. There's a bunch of misinformation out there about the vaccine causing infertility, and there's no evidence of that, like whatsoever. And actually, if you look at the trial, 26 women got pregnant for the Pfizer trial, but the other trials are about the same. 26 women got pregnant during the trial. There was one fetal loss, and that was in the placebo group. So clearly had nothing to do with the vaccine. So there's no indication that there's anything, affecting fertility. Already had COVID, and we don't know how long these antibodies last anyway. That's another thing that we heard. And it's true. We don't know how long the antibodies last. We probably think that we don't know how long the vaccine antibodies last. Those studies were done for 4 months, so they should last at least 4 months. We are starting to get data about how long antibodies last after you get COVID disease, and it may not be as long as we had hoped. This is from that same trial where they followed the people for 6 months to study their long COVID symptoms. And this looks at the COVID antibodies from when they were sick, which is the blue, and then when they did that follow-up 6 months later, which is the red. And all of these are just different types of antibodies. The ones that we care about are what they call neutralizing antibodies. So if they put those antibodies in with real COVID viruses, so they clump up and inhibit the COVID virus. And you can see that there's significantly less 6 months later. So you may not last just from having COVID, your immunity may not last as long as we had thought. And we're seeing data now where examples of people who get a new infection of COVID after they've recovered. So not like the old infection, like coming back, but they can actually like look at the genes in the virus and sequence the DNA and prove that it's a new infection with the new COVID virus. With the vaccines, how long does the immunity last? Like we were saying, the study's tracked for 4 months, and then they're just continuing to collect data to find out how long it lasts, because we don't know yet. Should you get the vaccine if you already had COVID? Yes, because we know the natural immunity doesn't last forever. We know people are getting COVID twice. Now there's new strains. And so even if you have immunity, a vaccine can help boost it. So this kind of summarizes all of those details that we just talked about. So it's true, we don't know the long-term effects of the COVID vaccine, but we know the short-term effects of the COVID vaccine, which aren't that bad. Basically, you feel like you have the flu for a couple of days. And some people may have an allergic reaction, but that's true for anything you put in your body. But we know the short-term effects of COVID, which are pretty, most people have mild disease, but if you have more severe disease, it can get pretty bad, and your risk goes up depending on all your various risk factors. So you need to, factor those in for yourself. And then we do know the long-term effects of COVID now. We're starting to get more data on that. And it's looking like even if you didn't have severe COVID, you still can end up with long-term fatigue and depression, anxiety, abnormal lung function tests, and other permanent organ damage perhaps. So even though we don't know this, we do know that. So it's however you balance the risk, but hopefully this will help you do that. Now there's all these new strains of COVID. So what's up with that? So basically it's like, there's new data coming out every day. So this is shows kind of what we know so far. These ones with the little 2 stars that fade into the distance, that means that there's not data. Because at first I was like, why would they make the bar like that? But the orange is the vaccines efficacy against just the normal, the regular COVID that we've all been dealing with. And then these blue and the white are the 2 different variants that are out there. And so you can see it seems like it could be less, but we don't know exactly. But we do know, though, that in Israel, sort of like a real world experiment. So in Israel, they've done a really good job. They've got the majority of people 60 and over have been vaccinated. And that was with the Pfizer vaccine, I think. And since they've done that, the cases have dropped across the whole population, 41%, hospitalizations down by 1/3. And that's despite, they've had a lot of those variant strains in Israel. So just getting the vaccine in as many people as you can helps stop the overall spread in communities. And then the mRNA, one of they made these vaccines so fast, and the mRNA vaccines are kind of cool in that if there's a mutant strains, it's pretty easy to make a new vaccine with the updated RNA in it. Pfizer and Moderna say they could probably do a new one in as little as 6 weeks if they needed to. And then of course they have to test it and stuff. But so it could be that, like the flu, where it's going to be every year there's a tweaked vaccine. Dr. Fauci, what he says is the virus can't mutate if it can't replicate. So, even if the vaccines aren't as effective against the mutant strains as the original COVID, um, the less cases, then the less there is for the virus to replicate in people and be transmitted and mutate. So the best way to fight these mutant strains is for as many people as possible to get vaccinated as soon as possible. And even if you do get a new strain, um, it's much likely that you'll have a milder case of that new strain if you're vaccinated than if you're not vaccinated. And then why do you have to still wear a mask even if you're vaccinated? And that's because scientists haven't yet determined whether or not vaccinated people can still spread COVID. We know that vaccinated people have antibodies in their blood that keep them from getting sick. They haven't finished studying whether you have those antibodies like in your nose and your mouth. So it's possible that you're not sick, but you don't feel sick, but you have virus that's replicating but not making you sick in your nose and your mouth that you could spread to others. It's looking like it's probably not the case that you're contagious, but they need to be sure. And right now, still, there's so many people that are unvaccinated that the recommendation is still to wear your mask. And then there's this, I've heard stories about people testing positive for COVID just a few days after they got the vaccine. So like, what's up with that? Like, does it really work? And to know why that is, you have to kind of understand the time course of it. This is the data from the Pfizer and the Moderna, and the Johnson & Johnson looks about the same, where this is the days after you get your dose. This is the percentage of people that get COVID. And for both of these, you really don't start to see a difference until about 14 days, which is the same with Johnson & Johnson too. So if people are getting COVID right after they got vaccinated, it's because they either had a COVID infection brewing before they got vaccinated, or they got it like just a few days after they got their first dose. So it's not the vaccine doesn't work, it's the timing. This is stuff that based on CDC, but it's what we're telling our employees. And, so, your guidance from your employer may be different, but, can you work if you're having vaccine side effects? CDC says you can work as long as you feel well enough to work, you don't have a fever, and that your side effects are limited to those that are kind of vaccine side effects and not COVID specific stuff like cough and shortness of breath or loss of taste or smell, because the vaccine shouldn't cause those. And what if you can't come to work because you're having side effects? We're telling our people just to follow the same processes if you have COVID, but if your side effects go on for more than 2 days, you should consider getting a COVID test. That's what the CDC recommends. And then what if you get the vaccine and then sometime in the future you have COVID symptoms? Again, just follow the same process as before we had a vaccine, because you could be that 5% that's not immune. This is the return to work. This is the same thing basically in a table form. And again, it's all based off the CDC requirements. We just put it in a table form to be a little more clear. And then we've been doing this big social media campaign to try to, encourage our staff to get vaccinated, to make it fun. Or people send your vaccine selfies and we post it on our social media, and some posters and stuff around because, and part of the reason we're doing this is to encourage our staff to get vaccinated, but we're also gearing up to start to promote it amongst our patients. And one of the why is that important is, besides all the comorbidities and stuff, we know our patient population, people with serious mental illness, and they're going to be at high risk for getting severe COVID if they catch COVID. And part of that's because their medical comorbidities. They tend to live in group homes and shelters and stuff where it might be easier to get it. Access to care, like they don't have the greatest access to care. But there's actually also data showing that, for example, schizophrenia, even if you adjust for the comorbidities, that there's a higher mortality rate with COVID compared to people who don't have schizophrenia. So this was a study that just came out showing there was a almost threefold risk of death within 45 days if you have schizophrenia. So kind of our strategy is we're kind of layering strategies on top of each other. So the kind of the base strategy is to have an educated staff that themselves have a high rate of being vaccinated so that they really buy into it. So when they're talking to patients about getting vaccinated, they're talking from their own experience and their own beliefs. So it's not like you have to train them to talk about vaccines because they've gotten that education and they buy in because they got vaccinated themselves. So that's kind of where we're at currently. We're starting to put together some patient education. I'm starting to talk about vaccines with patients, and then ultimately we want to have on-site vaccination, and every state's different. We've done all the regulatory hoops with our health department and gotten the right refrigerators and stuff. We're just waiting on supply, but as soon as we have supply, we want to be able to offer that on site. We do that currently with flu and Hep A vaccines. And so what we're starting to do is start to talk to patients as we're asking, because we have it baked into our process that we ask people about flu and Hep A before they discharge, and starting to ask their thoughts about COVID just to kind of prime that pump. And then I want to get I'm a vaccine booster pins and stuff, but I got to convince finance to let me buy them. But just to really have that culture of ask me about my COVID vaccine from the staff. One of the requests for when I was asked to do this was to talk a little bit about talking to patient vaccination. And so it's kind of like, y'all are all behavioral health folks, you get motivational interviewing and all of that. It's kind of similar strategy. You want to ask permission. Is it okay if we talk about COVID vaccines and not be judgy? It asks open-ended questions to understand their perspective. What concerns do you have? What have you heard? You'll be surprised when you ask that question, and people they've heard all kinds of far out conspiracy stuff from memes. So I always say, don't get your news from memes. Be an example. Talk about the fact that you got vaccinated and what it was like for you. And it sucked for a day or two, but sure glad I don't have COVID. That'd be way worse. If you're providing educational materials, use trusted sources, local health, CDC, of course, but your local health department, that they always have good stuff, because then it's going to talk about how did they get vaccinated in their own community. And then acknowledge the stress of this past year. And then you could present the vaccination as a hopeful thing, because that's the path to this pandemic finally ending. The more people get vaccinated. And then be aware of the racial disparities. There's decreased trust among African Americans because we have a long history of having a healthcare system that has not been meeting their needs. And then a new study came out of Maryland just recently looking at the suicides during the lockdowns. And that was striking, because suicides decreased among whites, but increased for blacks. So all of the stress of the pandemic is affecting people, different communities differently. And I'm going to give you the link to if you want this is a handout that we've been using for patients about managing your stress during a pandemic. It kind of goes through some of the mindfulness type stuff, and then really keeping on a schedule. But this really, especially with all if you want to be relevant to vaccines, is control what's in your control. Remind, and then also you don't have to spend time watching the news all the time. And that's a big thing, is stop watching constant doom and gloom. You can turn off for a little bit. And with that, I'm ready for questions. And then we put a bunch of our COVID stuff, and I'll stick this PowerPoint up there too, on I have a Dropbox. And so we've shared a lot of our education materials and protocols and stuff like that. So they are free for any of y'all to use if you want.